All right. Well, welcome back to the podcast. I'm your host, Ben Imes, exploring the depths of healthcare. Really excited for our episode today. We've got a very special guest. Glenn, why don't you introduce yourself and kind of a little bit about yourself?
Hey, Ben, glad to be here. Glenn Loomis. I'm a family doc by background. Spent 10 years teaching young docs and then 20 years leading health systems and then 5 years in sort of virtual healthcare and startups and now have my own startup. So if you'd have told me when I was in medical school that someday I'd be building a IT company, I'd have said you were nuts. But here we are. So there you go.
Yeah. And no one prepares you when you're in medical school. They say, okay, you're going to be like family physician trained. You're going to be in primary care till the day you can't walk out of the office.
Exactly. That's what you think. And then you find out that the world changes and you have to change along with it. Stuff
Yep.
happens.
Yep. And so give us a 10,000 foot view. What's kind of brought you from, the practice of, kind of teaching and training others, and then what brought you out of kind of switching out of the practice setting into more the kind of virtual healthcare kind of side of things?
Yeah, I guess maybe it's partly what brought me to family medicine in the first place, which is
Hmm.
probably that I have a little bit of attention deficit disorder, or, I'm not sure, but I enjoy a lot of things. I could never imagine myself sort of doing sort of one disease process over and over for all of my life. And so I
Yeah.
ended up in family medicine. And
Yep.
then I enjoyed all the aspects of it. And over the years, I got to experience a lot of different aspects of it, practice, military, teaching.
Hmm.
And then throughout all of that, I've always been sort of the idea guy, I guess, and the IT guy. And so I started by being in one of my first places of work. I ended up leading implementation of Epic, which is a big electronic medical record system. And I was good at that. And then got given other duties and sort of along my career, I ended up leading multiple Epic implementations, a Cerner implementation, a bunch of other EHR
Hmm.
implementations, and then I actually for a couple of years ran an innovation department where we went out and tried to find the coolest software available and implement it in the health system. So yeah,
Yeah.
I've always sort of been that guy, who has a lot of different interests, and that's kind of how I ended up here, I guess.
And so basically you're saying you were a super user and just kept graduating.
Yeah, kind of like that.
Yeah.
And I think it's just by nature, I'm super curious. I like to figure out how things work, figure out how to make them work better, figure out how to, make things better for all the people I work with,
Yeah.
and for my patients. That's always at the heart of whatever I do.
You're a system optimizer, if you could wear that tag, is what it sounds like.
100%. I think
Yeah.
that's a pretty good tag.
Yeah. Yeah. And so, it's a big change to go from, practicing physician to mixing with IT, but then now even to talk about like business ownership of any type. What are some of the big lessons you've learned kind of through that process, kind of the hard knocks?
Yeah, I think as you grow in your career and learn how to be first a manager and then a leader, you learn a lot of lessons. And probably the biggest one is that there is a place where you can't do everything by force of personality yourself. You have to learn to manage through other people. You have to learn to create a team, build a team, hold people accountable, all those things. And so I think that's the hardest step, like getting from the place where you're managing a small team and you can get around to everybody and you can, sort of, cajole people into doing what you need them to do or whatever. And then getting from there to the place where suddenly, I had maybe 200 physicians or 500 physicians and spread across 50 sites and, whatever. And eventually you just have to learn how to build a team and create an environment where the right things happen. And then now creating, building a business is even more challenging, right? Because I have to do a bunch of
Hmm.
things I've never had to do before. Raise money, build a sales team. What do I know about sales?
Right.
And things like that. So, but I love to learn. And so, I'm always up for the challenge, whatever the challenge is, I guess.
Yeah, so it doesn't when you signed on to medical school, you kind of sign on to be a lifelong learner because the things you learned in practice or, a while ago, like, I mean, new data, new literature is always being tested and always coming out. And so are you going to be malleable to that or are you going to stay stuck in your ways? You know what I mean?
And I'm a big believer in, it's a good day for me if I learn something that day, right? And so, try to learn something new every day and push the envelope on what I'm doing and what others are doing and try to, you know, make something great every day. That's the
Totally.
key.
Totally.
Make a
I love that
difference.
mentality. I think it's really fun when guys, I always joke about this since a lot of my listeners will hear it, but it's becoming a theme with a lot of my guests as medically trained, but then when you have to wear the hat of business ownership, you weren't trained, in marketing, sales, you know, what the bottom line is, P&Ls, like all these different things that, business has, and that there's a whole, MBA program you can go to, or you can just learn by just attempting different things and getting the right people around you to learn from. Is that what you found
Yeah.
so far?
Yeah, absolutely. I actually did both. I sort of got thrust into first in the military, and then and then after that, I got thrust into positions of leadership that I wasn't really ready for, and sort of learned by the seat of my pants, so to speak.
Yep. Yep.
And then I eventually went and got my master's in business
There you go.
because I thought there were tools that I should know that I could have applied. And indeed, it was great having that experience. Actually, I learned a lot because I could apply in the classroom things that I was like, oh, I could have used this in that scenario, or I could have used this in this place. And so, um, yeah. So, what I've learned is that in medicine, being a leader, one of the skills that I have, I think, is the ability to translate.
Mm,
Because what I find is doctors and business people are often speaking two different languages, and
hmm.
they may be saying the exact same thing, but shouting at each other because they don't understand what the other person is saying because the languages are so different. Physicians speak in one patient. They speak about one disease process. They speak about one, right? Anecdotes, right?
Right.
Business people speak in terms of big picture, right? Populations and, diagnostic groupings and things like that. And so sometimes you have to be able to translate between those. And I think the other place you have to translate is translating between sort of doctor, business, and tech. And for whatever reason, I've been able to actually negotiate all three of those languages. And,
Wow.
that's another one where tech is a completely different language.
Yeah.
And, trying to get everybody on the same page as to how you build something that actually is applicable for the physician, for the business, but get that
Hmm.
into a language that your tech guys can understand and actually build. That's a feat unto itself.
A unique feat for sure. Using
Yeah.
that as our transition, what kind of brought you to this point? I mean, to develop the business that you have now in Query Health.
Yeah, it's been a long road, I would say. I was on a committee for the American Medical Association called the Long Range Planning Committee. As our job was to scan the horizon and try to see what was coming. And as we were doing that, it caught my eye, and this is, I don't know, 10 plus years ago, that,
Mm,
hey, there's this thing called AI, and it's going to really impact us in medicine, and nobody
mm,
knows anything about it. And so I started by working there with the committee. My chairman year, we actually published the first AI report for the American Medical Association, but it got me really interested in it, right? And so from there, I spent a little time working with IBM, working on Watson, trying to figure out if we could make a sort of AI doctor out of Watson, but it
hmm.
really wasn't up to the task yet. So sort of scrapped that. But I kept learning, and then I went on and got my board certification in AI medicine so that I could really dig deep and understand AI sort of at its core. And then
Hmm.
when large language models came out last year, I mean, really came to prominence last year or the year before, I really said, I think that AI doctor idea is something we can actually do now. And so last fall started a company, and here we are with a functioning AI doctor agent.
Really
It's been
cool.
a wild ride.
Yeah. Okay, so how many physicians are AI or board certified in AI healthcare, AI medicine? Is that what you call it?
Yeah, it's a AI medicine board
AI
certification.
medicine.
Not very many. I don't know the actual number, but it's got to be less than a few thousand. So,
Yeah.
and it was a very, I've taken many board certification tests
Hmm.
in my career. That one was really, really difficult. I didn't think I passed, to be honest. I was like, oh my God, this is just amazingly hard.
Yeah.
But ended up passing. So, it was, that was an exciting day when I got that back. But, um, yeah, you have to learn a lot of different pieces because it's not just LLMs, right? It's different things, natural language processing, natural language, understanding, all these different facets of AI. And,
Hmm.
as you learn about it, you're like, wow, what we can do now and what's coming is even crazier, but what we can do now compared to even what we could do 4 or 5 years ago is,
Yeah.
unbelievable.
Yeah. What do you see on the horizon that you're really, gets you really excited to learn and to implement?
Yeah, I think the biggest thing that I see is just I think LLMs are gonna get continually better, but I suspect that there's another, sort of evolution that's coming past this, which is now we're using large language models. I think we're going to use, we're going to move on to large visual models and
Mm,
other large models that are going to take us, you know, even further. It's funny because they always say a picture is worth 1,000 words, right? And
totally.
I don't remember who said it, but one of the big guys in AI said, a child learns basically 1 minute of seeing, you know, the amount of bytes or the amount of data that they ingest in 1 minute of seeing far exceeds anything we're doing with LLMs right now. And
Mm.
so as we go along, I think there are new models to come that are gonna really change how we experience the world.
It's cool to even think about and kind of translate that for, our healthcare. In my emergency medicine practice, I didn't learn my skills by reading a book about how to do a chest tube, right? I can understand all the specifics about it. I know where to poke, I know where to, cut, I know the steps to do. But until you actually see it done and you're visually like, see one, teach one, do one kind of mentality, then you never really like absorb it completely. It's not second nature at that point. So I'm really curious to see how AI can kind of build off of that same mentality.
Yeah, I agree with that. It's been interesting, I mean, my background in teaching has actually really come in handy as we've been building this AI agent
Hmm.
because building an AI agent is very different than building a piece of software. Like, when you build a piece of software, you say like, okay, here's the problem. We want to get to this solution. Now we got to make it go from A to B to C to D to E to F,
Hmm.
all the way down the line. When you build an agent, you basically say, here's the outcome we want. Here's the set of facts that we're going to be able to give it. Now we have to basically build a prompt that teaches the LLM how to think about the problem to get the
Yeah.
outcome that we want. So it's very much like teaching a resident or a medical student. You're
Yeah.
basically inculcating in them the principles of how to approach a situation.
Yeah.
So that's been really interesting for me. Like, you don't really need a lot of engineers to build an agent,
Hmm.
but what you do need a lot of is a lot of subject matter experts that,
Right.
we have a number of docs on our team, a number of other healthcare providers, because you have to be able to sort of, no engineer is going to be able to write a prompt
Right.
that says how we think as a doctor. Like, you've got
Right.
to have doctors doing that. So
Yeah.
it's fascinating.
Really cool. And so, how is this AI agent? Are you helping healthcare systems with it right now? What's the kind of process of how you're developing your business and what you're using this for?
Yeah, so what I chose, there's a lot of people doing all kinds of things in AI on the sort of administrative side of healthcare, right?
Hmm.
Coding, ambient scribing, all
Yep.
those kind of things. What I decided is I really wanted to build an agent that thinks, acts, and does like a doctor. And so I really wanted to go after the clinical side as much as we could while leaving the doctors in control, leaving them in the middle, but trying to automate as much of the sort of patient physician interaction as possible. And
Okay.
so what we started with was building an agent that learns how to question you based on whatever symptom you show up with, whatever diagnosis you show
Mm,
up with, whatever. And it goes down the path that you or I would go down, right? It asks, PQRSDT, it asks, all the things that we are taught. We
mhm,
have taught the agent to go in and ask those questions and to get to a place where it says, I can confidently give you a diagnosis, or I can confidently give you a treatment plan, or I can at least give you one that's based, that says at a 70% confidence
sure,
level,
sure,
this is probably what you have, and this is probably the best treatment plan. And so
yeah,
we did that. We built the agent that does the history taking. We now have finished the sort of diagnosis and treatment planning piece of it. So it gives the doctor then a set of diagnoses, either a differential if it's an acute problem,
mhm,
or the best possible diagnosis if it's a chronic problem, and then gives you, hey, here's the best treatment plan based on available evidence. Here's where all that evidence came from. It's all tagged.
mhm,
And so it's very the way you and I would want it, right? I don't want to be told what to do, but I love having it served up for me so that I don't have to spend a lot of time extracting data from a patient and
mhm,
then trying to figure out, well, when was the last time this weird thing showed up in my office and how do I treat that?
yeah,
It just shows up for me now and I'm like, oh yeah, that's reasonable. That's useful, right?
right,
And then going forward, we will actually give patients some of that information as well, the ability to query it and ask it, ask the agent, my doctor says I have congestive heart failure. What does that mean? And it'll give you sort of the same explanation that you or I would give them about what that means. So yeah,
all that
that's
I'm
that's where
hearing
we're
is
at and where we're going.
cut down on the time. I just hear efficiency, efficiency, efficiency is all that I hear.
Yeah, we're focused in two places. One, efficiency, right? 100%, we think we can cut out as much as 50% of a visit time
Wow,
probably,
wow,
because we actually give the patient the agent reaches out to the patient at home through our app and speaks to them just like you or I would speak. You can
yeah,
text if you want, but it's a voice agent. It also can take OCR pictures. You can show it your pill bottle and it'll ingest that, or
wow,
whatever.
yeah,
And so it reaches out, it takes all that information, it gives the patient all the time they want. They can take as long as they want to talk to it, to give their history or whatever it is that they're coming in for. And then it puts all of that into a soap note that you and I can easily go through and go boom, 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 boom. Okay, I know what this patient is about, right? Now I can go in, I can confirm a couple things, I can ask a couple extra questions if I didn't feel like it got it exactly right.
right,
And then it gives me the diagnosis and treatment plan that I can choose to use or not use. And so cuts a ton of time out. Also gives people in places where maybe, so I have a lot of my family that live in rural areas and maybe don't have access to the greatest healthcare sometimes, and sometimes get weird advice from my point of view. And I consider myself a good doctor, so hopefully it's not me that's weird. But they get some weird advice and I'm like, I want to serve up not only efficiency but effectiveness, right?
mhm,
I want to make sure that that latest greatest information is teed up for the doctor who maybe is overwhelmed where they're at and they just haven't had time to get out and get that latest greatest information, right? Because everybody, to me, everybody in all the corners of our country and in the corners of the world for that matter, they deserve access to the best information. And so that's what we're trying to
yeah.
accomplish.
Yeah, that's so cool. I mean, I think that's one of the biggest things, especially with kind of where healthcare is going today. I mean, with the Medicaid and Medicare cuts, that remains to be seen about these rural kind of populations if they'll get kind of shut to the side. And if these hospitals, like complete hospitals, might shut down in these rural locations. And this gives an opportunity for physicians from afar to be able to treat the patients very effectively.
Yeah, absolutely. I foresee that, like, one of the things that we're in the process right now of building is this idea of a curbside consult,
Mm,
an AI curbside consult. So basically, you take all the information that maybe we're normally looking at through a primary care lens, and we say, as a doctor, I can say, well, what would a gastroenterologist say about that? And it'll
mm,
run it through in the guise of a gastroenterologist and maybe give me a different lens. Or what would a nephrologist say about that? Right. And so I can get these curbside consults in the middle of nowhere without having to try to figure out how I get on the phone with somebody, I get
Hmm.
them to actually answer the phone, right? You're an ER doc, you know how that goes. So, and so I think that doctors are really going to love that piece. It's kind of like the idea of having, in cancer, we have this idea of a cancer committee, right? That gets
Yeah.
together from multiple points of view, looks at a case, and then spits out, hey, here's the best plan of attack for that thing, right? And so sometimes in the emergency room or urgent care or in my office, sometimes you have something weird and you're like, hey, I wish I had a surgeon and a GI doc and a pulmonologist that could weigh in on this. And so this is going to be kind of like that, to give you that in a virtual way.
I mean, how cool is that to have a roundtable effect to say, hey, patient A, you came in with these complaints. I now have three physicians giving their input to work together to come to a plan for you.
Yeah. And again, at the end of this all, from my point of view, we're not trying to replace physicians. We're trying to make them more effective and more efficient, right? And so give them the tools and maybe actually make practice fun again, right? Where you're just doing the brain work. You're not having to do all this busy work, and not trying to talk to somebody who, takes forever to get things out and whatever. You can just actually use your brain to say, hmm, what it served up for me makes no sense, and so I'm going to go back to the drawing board. Or boy, that makes a lot of sense. Or I need to just tweak it this little bit, right,
Right.
for my circumstance or my geography or whatever. So, hoping that we can make practice fun again for providers.
Totally. I mean, it takes away from that. I mean, we all enjoy a story when they say, well, back in 1973. And
Yeah.
with those few words, we all know where that history is going.
Yeah, well, the other one is when you've got your hand on the door, you're getting ready to leave, and
Yeah.
they go, "Oh, by the way," and you're like, "Oh man, my day is shot," right? Because typically the "oh, by the way" is, my husband's beating me, I'm depressed,
My vision is
I'm
super blurry.
right, yeah, or I forgot to tell you about the chest pain I'm having. Oh, great, thanks, so yeah.
That's how it always goes. I mean, I've actually, it's just funny you bring that up because last night I was about to discharge a patient. I was working overnight, and she goes, "Oh yeah, by the way, I have blurred vision. I don't know where that's from." I'm
And you're
like,
like, well, there goes my night.
"Yep." I'm like, "Okay, well, almost had you out the door, but
Yeah, yeah.
guess not anymore. Guess we got to hit the playbook again." But
Yeah, so so like our agent, when it's taking the history, ends whatever it's doing with, "Do you have anything else you'd like to ask about today?" Right?
oh
Just to
yeah,
try to make sure all of that stuff gets out before they come in, so that you've got it in front of you rather than having to try to wade through that.
totally, totally. Very cool. I mean, this is something that definitely a lot of primary care, acute visits, urgent care, emergency medicine could very much utilize. Do you guys have plans to scale beyond that into different specialties, or we're more keeping it in the generalist medicine scope at this point?
Yeah, we're actually building out all the main specialties right now. So we'll have it available for specialties. And now we've actually had a bunch of other people come out of the woodwork and say, "Hey, what about, could we use this in home care? Could we use this in,
Mm.
and so there's a lot of other applications where somebody needs to reach out to the patient and do a sort of history or a check-in, if you will. And we've built now an engine that thinks like a doctor. And so it's pretty easy for us now to send that, to put that into different areas and make
Right.
sure that we can apply it in a lot of different areas. So we'll try not to get too diffuse at first. We gotta see, we need certain amount of laser focus on getting this out the door, but pretty
Yeah.
excited about the possibilities.
Well, yeah, it sounds really exciting. I mean, obviously, you want to win this sector first that you're focusing on and make sure that it's a good product and then be able to spread it out. Unless you get spread too thin, things get a little hazy at that point.
100%.
What
So
about what are you guys thinking about? I mean, what are some of the, I mean, obviously, the biggest headaches right now with being a startup and being kind of a smaller business? You know, a lot of my listeners are very aware that, fundraising and all these different things, but what are some things you didn't expect as much to be kind of at the forefront of kind of roadblocks in a sense?
yeah, I mean, money is always the roadblock. You'd like to have more than you have always. The other roadblocks I think are, it's always about building a team, right? I'm really fortunate. God has given me a good team. So built a really good team and fortunate in that regard. But it's always a challenge to build a team and keep them working together. We haven't had a lot of all of the sort of intriguing things have been around the technical side, I would say. There's not really a lot of expertise in building agents out there. It's not like I can go out and hire an engineer who's got 5 years of experience building agents
Right.
because it's only a year or two old, right? And
Right.
so, we basically are having to make it up as we go. We also, I would say another one has been doing the QA. We have doctors and PAs and nurse practitioners looking at doing standard cases for each iteration of the agent. And as
Hmm.
we were doing that, we're doing maybe 50 standard cases per iteration to try to see, is it doing what we want it to do? Is it doing it efficiently? Those kind of things. And we were like, it'd be great if we could just do more QA than we're doing. And
Hmm.
so we built an agent that actually goes through, does the case, talks back and forth with the other agent and scores things at the end. And so basically right now what we do is we run cases through hundreds of QA cases
Yeah.
each iteration. And then once we have an idea of, is this a good agent or we should go back to the drawing board and leave that one on the scrap heap. If we think it's good, then we can pass it off to the humans to actually go through and do it at a little deeper level. So that's been pretty cool.
Yeah.
Yeah, a lot of interesting stuff on the tech side that we've had to learn and invent.
Well,
Uh,
it's all new territory. I mean, no one's really kind of. I mean, this is all just in development, and so everybody's just developing and trying to test and make sure that it's appropriate and that it's safe. And I just love that
totally.
you're on the forefront of that.
Yeah, I'd say the other thing is just getting the voice part of, when we started last fall, a year ago, we we weren't even sure if the voice agent part was going to be good enough to actually do. You're right. We may have to stick with the chatbot thing.
Hmm.
But it caught up, but it still has issues a little bit, right? Like the
Right.
latency is a little bit of an issue sometimes. And depending on the background noise and things like that. So that's been an interesting one. And then the other interesting one is teaching your agent uh, to have good bedside manner, right? Not just be a robot. That's
Right.
still in development. I would not say that we're 100% on that yet. It
I
still
mean, how
has
do you,
work to do.
it's developing an EQ for an AI agent. I mean, that seems about as complex as it gets.
It totally is. I actually know a guy who's building agents for a different reason, and that's really what he's focused on is that
Wow.
sort of making it make you feel good, right? And so
Right.
hopefully we'll build some of what he's done into ours, but
Yeah.
yeah, it's a challenge.
It's just fun to hear and how things are kind of progressing. I mean, across the board. And what this could do for healthcare, I think the scribing stuff is really great for providers. If that becomes more diffusely present, great. But I mean, if we could add all of these tasks or these efficiency models together, I think, like you said, maybe physicians and PAs and people will be more excited to continue working for longer instead of trying to get out of medicine, as the trend is kind of progressing. You know what I mean?
That's what I'm hoping. I mean, that's what we're trying to create as a platform, not another point solution, right? So
Right.
something that can go through that entire workflow that a physician has with a patient and even out the other end to be a question answering and save some phone calls and all that kind of
Hmm.
stuff. So sort of replacing a lot of different, there's a lot of people building point solutions, but
Yeah.
I always said when I was buying software, right? Don't sell me Microsoft Office. Microsoft Word. Sell me Microsoft Office, right? I don't need one little thing. I want to buy it in a package if I can, and so that's what we're trying to create.
Yeah, you don't want the wrench. Give me the whole toolbox.
Give me a toolbox, right?
Yeah, I love that. Well, Glenn, as we kind of wrap things up, I mean, where can people kind of look for Query, or kind of if they're interested to get more information or following you specifically on your journey, where can people kind of find that?
Yeah, great. You can find us on LinkedIn at either me at Glenn Loomis MD, GLENN LOOMIS MD, or Query Health. And then online, you can find us on our website. It's queryhealth.ai. So, .com was taken or something. I don't remember why we went with AI. But anyway, queryhealth.ai. And yeah, follow along if you have listeners who are interested in being an early
Yeah,
adopter, or just contact me. I'm happy to have the conversations. We're looking for early adopters who want to change the world, and
yeah.
yeah, excited to talk to anybody about it.
Yeah, and that's I hope, I mean, a decent amount of my listeners are in the medical field and are medical providers, so I hope that they'll reach out to you and kind of spur that on through this episode.
Yeah, I'd love to talk to any of them.
Yeah, sounds good, Glenn. Well, thanks for your time today, man. Really appreciate you joining us.
Ben, it's been a pleasure. You're a great host, and an easy interview. So I appreciate the time to come on and tell you guys about Query Health.
Love to explore the depths of healthcare with you. Thanks for giving us some insight into your business, and really excited to see where this continues to grow.
Awesome. Have a great week.
Thanks, Glenn.